and we'll just give it a couple minutes. Whenever you want to say go, just let us know, and we'll start from there.
I think in the interest of those people who were logged in on time, we should get started. So hello, and thank you for joining Longhorned Tick and Other Ticks of Concern in Minnesota, What Veterinarians Need to Know, featuring Doctors Jenna, Bjork, and Stacey Schwabenlander. For those of you who don't recognize my voice, I'm Nicole Cass, the CE Program Manager for the Minnesota Veterinary Medical Association, and I'm pleased to be your moderator today. If you do have any questions during the session, please type them in the Q&A area. Also, you should have received an email about 11:30 this morning that does have a copy of the slides and 2 handouts, which I'm sure they'll be referring to later on. I would like to take a moment to introduce today's speakers. Dr. Jenna Bjork graduated from Iowa State University College of Veterinary Medicine and the University of Iowa College of Public Health in 2011. She joined the Minnesota Department of Health Vector-Borne Disease Unit in 2013 and currently manages tick fieldwork activities, epidemiologic studies, research studies on tick-borne diseases, and vector-borne diseases outreach efforts. Prior to joining MDH, she worked for 10 years in various positions within the veterinary field as a veterinary assistant, research laboratory associate, and companion animal veterinarian. Her professional interests include exploring the interfaces between environmental, human, and animal health. Our other speaker is Dr. Stacey Schwabenlander, graduated from the University of Minnesota's College of Veterinary Medicine and School of Public Health in 2007. Sorry about that. She spent 2 years in private practice in Green Bay, Wisconsin, and she's been working with the Minnesota Board of Animal Health since 2010, and is currently
Nicole, this is Stacey again. Would you like us to go ahead and begin, or should we wait a couple more minutes?
Stacey, are you unable to hear me? Is anybody else?
Maybe Nicole's not on.
No,
is there anyone else who's on? I don't know if you have the ability to speak and let us know whether or not you can hear us. It would be helpful to know whether or not you can hear us and see our screen before we begin.
Okay, thank you, Dr. Neeser. She says she can hear me. Stacey, I'm going to let you go ahead and begin. And we can hear you.
Oh, okay. Oh, okay, perfect. Thank you, Nicole.
Yep.
All right, well, perhaps we'll go ahead and get started then. As I mentioned, my name is Stacey Schwabenlander, and I'm a veterinarian with the Minnesota Board of Animal Health. And of course, I'm talking first, and I'm confusing you guys because the slides are swapped. But I oversee cattle programs here at the board, and I've been with the board for about 10 years. And a lot of you may know that the Board of Animal Health doesn't have any specific programs that are, again, specific to ticks or tick-borne disease. However, we do have the ability to reach out to different stakeholder groups, such as accredited veterinarians, livestock producers, different other groups. So we are a really good conduit to be able to get educational information out when there's things that we want to be able to share with the veterinary population as well as animal owners. And so this is an opportunity for us to be able to do that and be able to share some information that's been happening related to this longhorn tick. And with me, I will let Jenna introduce herself.
Hello, I am Jenna Bjork, and so I am a senior epidemiologist at the Minnesota Department of Health, and I've been with the Vector-Borne Diseases Unit since 2013. So almost for 6 years now, I've been concentrating on learning all I can about ticks and mosquitoes. My background is in small animal medicine, and we teamed up with the Board of Animal Health very recently to combine forces and really get some messaging out there about the longhorn tick and other potential invasive tick species here in Minnesota.
So here are a few of the points that we're going to chat with you guys about today. We'll be reviewing general tick biology as well as having a discussion about the ticks in Minnesota that can be a concern for both yourself, your clients, and their animals. as well as how to recognize potential invasive threats such as the longhorn tick. For those of you that have been watching the news the last couple of years, the longhorn tick has been something that's come up since the end of 2017. So this is what specifically has spurred this conversation. We'll also be discussing resources that are available to you with both the board as well as the Department of Health, and who to contact for any follow-up questions or information if you have a tick itself that you would like identified to see whether or not it fits into any of the groups that we'll be discussing.
All right, so to start us out, I'm going to cover some tick basics so that we're all on the same page. Essentially, there's over 800 species of ticks that are found throughout the world. Most of them are in the family Ixodidae, which are hard ticks, and there's also a couple, over 100 different species of soft ticks that are in the family Argacidae. And so ticks can also be categorized by biology and behavior. And so some fancy words in the tick world, nidicolous means that a tick stays with one host throughout its entire life cycle. And so they're also known as one-host ticks. On the other hand, there are non-nidicolous ticks that occupy more open, exposed habitats typically found out in the environment. And they're also known as three-host ticks. And so host and habitat preferences are very important considerations when we're looking at different tick species. And so depending on the habitat specifications and the host preference, this creates risk across time and space. And so risk varies over geography across large and fine scales, and risk varies over time depending on how land use changes and how hosts introduce ticks into new areas. And so not all of these tick species are a concern to us, though about 7 different genera of species in the Ixodidae family and about 3 different genera in the Argacidae family are of veterinary or medical importance. And so in order to become a species of medical and veterinary importance, the tick species needs to be able to acquire a disease agent, maintain infectivity throughout its life, transmit it successfully, and the tick has to actually feed on a susceptible host in order to spread a disease agent. And so just some differences between soft and hard ticks. I've listed some of the distinguishing characteristics here. On the one side, we have soft ticks that are tough, leathery ticks. They have several different nymph stages. They live primarily in the nest of the host and don't venture far from that. They feed on the host for only a matter of minutes, so they're very quick feeders. And the female can lay several batches of eggs after each of those blood meals. Grossly enough, they can live well over 10 years and can survive years of starvation, so they can withstand many years of not taking a blood meal. On the other hand, Ixodidae are hard ticks, and so they have a hard dorsal scutum. They only have one nymph stage. They live in open, exposed areas out in the environment. They feed on a host for several days, and so typically it takes at least 3 to 5 days for them to complete a feeding. The female only lays one large batch of eggs at the end of her life and then dies, and so typically they live about 2 to 4 years. For the presentation today, we'll be focusing primarily on hard ticks. And so in regards to ticks in Minnesota, we have a very unique landscape with the convergence of several different ecosystems with the northern forest, the eastern temperate forest, and the Great Plains. And with this unique landscape comes a variety of wildlife and vectors. And so in Minnesota, we have about 12 different tick species, but not all of them are a concern to people or spread disease agents to people or animals. And so in terms of a public health risk, most of our tick-borne diseases occur in the wooded parts of our state because the black-legged tick, which is formerly known as the deer tick, has emerged and become more common in these areas. Since it's our tick of highest concern in Minnesota, I will highlight this species in the next several slides and use it as an example of an invasive species. And so this is the ideal tick habitat where you'll find black-legged ticks. Most of the time, they're within deciduous or mixed woodlots, and they really need the humidity and warmth of this dense woodlot habitat in order to survive. Rarely we have come across black-legged ticks adjacent to woodlots or even in the short grass that aren't far from woodlots. But they're not like wood ticks, you know, American dog ticks, in that you can find wood ticks more in open and grassy areas. Black-legged ticks are more susceptible to drying out, so you're really just going to find them in this type of habitat. And so in general, the black-legged ticks really spends most of its life in the environment. It's that 3 host ticks. And so it typically lives about 2 to 4 years and has 3 active life stages within that amount of time. And so after hatching from an egg, a 6-legged larva needs a blood meal in order to molt into its next stage. Larvae typically feed on small mammals like mice and other rodents and will become active in the summer. After that blood meal, it will fall off, molt into an 8-legged nymph, typically the following year. And so in the summer, typically this time of year, mid-May, nymphs become active and they start looking for a blood meal. Nymphs are not as host specific, and so they will feed on small mammals or large mammals. And after a blood meal at that stage, they'll again fall off and become an adult, typically becoming active in the fall of that same year. And so adults primarily feed on large mammals such as white-tailed deer or other humans or any other larger mammal. And it is then that after a blood meal, the female will mate with the male, lay a large batch of eggs, and die. And so in terms of their host-seeking behavior, black-legged ticks live, again, most of their life out in the environment. And so they live in that leaf litter layer on the forest floor. And when conditions are right, typically if it's above 40 degrees, there isn't any snow cover on the ground, they'll crawl up on a vegetation and hold their front legs out when they sense a host nearby. And so they can sense vibration, heat, carbon dioxide, those types of cues. And if a host walks by and brushes past them, the tick will grab on with those front legs and start to crawl upward, where they will find a nice hidden place to feed. Some misconceptions abound with ticks and tick-borne diseases. And so just to clarify, black-legged ticks aren't able to jump, they don't fly, they don't fall from the tops of trees, and fun fact, they actually don't have eyes, so they can't see you coming. And so, well, we try to refrain from predicting how bad a year will be for ticks and tick-borne diseases because there are a lot of different factors involved, like weather, host abundance. There are some seasonal aspects to when black-legged ticks are active in Minnesota. And so the next 4 slides I'll show are some preliminary data based on a study we performed from 2015 to 2017 based on collecting ticks from 4 different sites in Minnesota. We went to the same piece of land at 4 sites, collected ticks every 2 weeks from April through November. And this is a nice slide showing that all that data combined, there's 4 different colors of dots on here based on the different sites. And I lumped them into a general calendar year. And so larval black-legged ticks typically come out in June, July, and August and are inactive the rest of the year. However, nymphs have a little bit different type of seasonality. You can see that mid-May is typically when nymphs start to become active, so any day now. They're really active primarily in June and through July, but they can linger and become stay active throughout the rest of summer and even into early fall. Adult black-legged ticks are primarily active right away in the spring as soon as the snow melts. Their activity dwindles as the summer becomes hotter and drier. They don't fare as well. And then again in the fall, when that new cohort of ticks that had fed as nymphs in the summer, they emerge in the fall, which is in contrast to what a lot of people know with adult American dog tick behavior. With wood ticks, as people commonly know them as, they really take a little bit longer to emerge. And so May and June are top months for when wood ticks become active, but you'll see that we do not see them active in the fall. And so switching gears a little bit to how the black-legged ticks actually vector different disease agents, you'll see that in Minnesota, we have 7 different disease agents that black-legged ticks can transmit, many of which affect humans and animals. and they've really only been discovered in the last 20 years. In addition to black-legged ticks spreading new disease agents over time, black-legged ticks are also spreading across the state and across the country as they become established into new areas after being transported on their animal hosts. And so this is a nice publication that was recently put out showing the black-legged tick distribution range throughout the country. And you can see that from 1907 to 1996, a lot of Minnesota is colored in white. Some of that is due to not looking for the black-legged tick, but over time, there has been a true emergence of the black-legged tick into new areas of the state. And so this is our current distribution map. We have it on our website, and essentially all those green counties are where we have documented the presence of black-legged tick populations. We are working on this as we consider the black-legged tick as being an invasive species and still emerging into new areas in Minnesota. And so in the next few weeks, we're actually going to be visiting those counties along the Minnesota River to look for populations of black-legged ticks. And so the progression of black-legged ticks across the state can also be seen in these maps as our Lyme disease incidence has increased over time. And so from 1996, you can see there's a small area in north central and northeast Minnesota, and that has slowly expanded into the northwest region and the southeast corner of the state. These are our top 3 human diseases that we have here in Minnesota. Lyme disease is in green at the top of the screen, anaplasmosis is in blue in the middle, and babesiosis is in red at the bottom. And so again, from 1996 to 2017, you can see there's this obvious upward trend, which is concerning. From year to year, reports of tick-borne disease can vary, again, depending on a lot of different factors between ticks, weather, host abundance, and human behavior. But there's definitely an upward trend. And so a common question that we get asked here at the Department of Health is, I found a tick bite on me. Does that mean I'm going to get sick? And no, not exactly. And so it really depends on the species of tick, the life stage of the tick. For Lyme disease, only nymphs and adult females take the blood meal and are able to transmit Lyme disease. It can vary for other disease agents, but the length of feeding also matters. And so the entire feeding process for, say, an adult female black-legged tick takes at least 3 to 5 days. And it takes some time in order to transmit that disease agent. And so for Lyme disease, it takes at least 24 to 48 hours of that tick being attached in order to transmit the bacteria that causes Lyme disease. And for anaplasmosis, it takes a little bit shorter, so it takes at least 12 hours. So it does depend on the disease agent. But in general, if you can get those ticks off you, the sooner the better. And the capacity of the host to become sick also matters as well. So some people and animals are able to fight off tick-borne infections asymptomatically. What we found when we collect ticks from across the state is that about 1 in 3 adult black-legged ticks is infected with Lyme disease or Borrelia burgdorferi, and about 1 in 5 nymphs is infected with that disease agent. And so this is a nice graph that shows on average across all of our sites and across all of our years, this is typically what we find. Sure, there's some variation between site to site and between year to year, but on average, this is what is useful when you are trying to determine your risk if you do have a tick bite yourself. And so you'll see that for all the different disease agents that we test for, adult infection prevalence is typically higher because they've had 2 opportunities to feed on an infected animal out in the environment compared to nymphs that have only had 1 feeding. And so with babesia and anaplasma, typically we find about 6 to 8% of ticks are infected. With our really rare disease agents such as Ehrlichia murus occlarensis, Borrelia miyamotoi, and Borrelia mayonii, typically only about 1 to 3% of ticks are infected with those rare disease agents. But we are monitoring them over time to see if they increase over time in space. And so combining all that data, when you look at what the chances are of a tick being infected with something, almost half of adults are infected with at least 1 tick-borne disease agent, and about a quarter of nymphs are infected with 1 disease agent. And when we look at co-infection rates, about 1 in 10 ticks is infected with at least 2 different things. So it's very possible for a human or an animal to become infected with, say, Lyme disease and anaplasmosis from the very same tick bite. So, in summary, the black-legged tick, also known as Ixodes scapularis, prefers the wooded and brushy habitat. It's found in most of the wooded areas of Minnesota and prefers small mammals as immature stages and large animals as adults, but it's really not very host-specific. It does have the potential to spread several different tick-borne disease agents, and please contact us if you have found a black-legged tick in one of those white counties where we haven't documented black-legged tick populations. We would love to hear about it. I'm going to go through a few slides that talk about other tick species of concern here in Minnesota. So the American dog tick is also called the wood tick. Scientific name is Dermacentor variabilis. It can be found in more open, grassy, as well as wooded areas. It's pretty much found throughout all of Minnesota, and it's not really host specific either. The immature stages prefer small mammals, while adults prefer large mammals. It can spread a few disease agents such as Rocky Mountain spotted fever, tularemia, tick paralysis. Rocky Mountain spotted fever is much more common down in the southern states, but we do have occasional cases here in Minnesota, and we even had a human death related to it about 10 years ago. So please be on the lookout for that, particularly in your canine patients. With tularemia, we also have very rare sporadic cases here in Minnesota in the humans and quite frequently in cats. So please be on the lookout for that in patients as well. Tick paralysis is possible, although it's much more common out in western states where Dermacentor andersoni is more common for that particular illness. And so we don't need to hear about all of your wood tick sightings, but if you do have suspected cases or you diagnose a case of tularemia or Rocky Mountain spotted fever, those are reportable diseases, and we work with the Board of Animal Health on those reports. The Lone Star tick is a tick that, as you can see in this map, is predominantly found in the southeast corner of the United States, but its range is expanding northward, and so it's becoming much more common in Iowa and Illinois, and we've been having sporadic reports of the Lone Star tick being found here in Minnesota. And so it can be found in wooded and grassy areas. It's not very host specific, and so adults will feed on large mammals and immature stages will kind of feed on whatever. And so itself can vector a lot of different tick-borne disease agents. And so please contact us. It's by no means reportable, but we would love to hear about any sightings that you have of the Lone Star tick, particularly if you have a specimen that you can send us. So we are trying to track its whereabouts. The brown dog tick is also known as Rhipicephalus sanguineus. This is one that's more of a one-host tick, and so it's really going to be found on its main host, dogs, or in the immediate vicinity of dogs, particularly kennels or houses can have huge infestations. And this is a tick species that's more common in the warmer climates, but it can survive in heated buildings, even up in Minnesota here. And so we have had rare reports of us hearing about it here at the Minnesota Department of Health. It can spread Rocky Mountain spotted fever and ehrlichiosis. So again, if you have a concern, we're here to help. We would certainly love to hear about, any infestations or questions that you have regarding the brown dog tick. And then the winter tick is one that I wanted to put in here. It's probably not one that you're going to come across very commonly. This is one that's also a one-host tick. It's Dermacentor albopictus, and it's found in forested areas, particularly near moose. And so this is one that primarily feeds on moose and rarely other cervids, horses, or livestock. And so the map that I have down here is based on a 2004 book called White as a Ghost. And so that's what's known for the distribution range of the winter tick. And so you can see that it edges down a little bit into northern Minnesota. We occasionally find Dermacentor albopictus larvae when we're out dragging for ticks in some of our northern sites in Minnesota. So it's possible that you may come across this species. It does not spread any known diseases, but it can cause severe infestations, hair loss, anemia, and mortality in the moose population. So again, if you happen to come across it, we'd love to hear about it, but certainly not reportable. And so if you do want to contact us, here's our information. If you have a tick that you have that you're suspicious about and want it identified, we do have a tick submission form on our website, or you can send us some nice quality photos to our email address. We have our mailing address right here, and we also have some specimen submission kits. If you're interested, please email us, and I'd be happy to mail your clinic, 1 or 2 kits just to have on hand in case you have a tick that you want identified. It's a postage paid, nice envelope with the submission form in there and everything you have to make it handy. So in terms of tick identification, I wanted to include a few slides in here, mainly for reference, but for those vets who really do want to dive deep and learn about tick identification, these are some helpful things. Essentially, try not to use tape. I know it's really easy to secure a tick by squashing it in some tape, but it can hurt some of the anatomical features that we look for when we're trying to identify it. So if possible, either throw them in the freezer. That's a good way to kill them, in a container first, and then put them in the freezer, or you can use 70 or even 95% ethanol to kill the ticks and preserve them. You can send us live ticks as long as they're secured in a container. I don't think the Postal Service appreciates that, but we don't mind it. We know how to handle them at that point. And so essentially, these are some of the things that we're going to be looking at. We look for festoons, anal grooves, the basis capituli, which is the head, and the hypostome, which are the mouth parts. These are the keys. They're published keys that are really important for looking at particular features on the ticks and telling species apart. And so I've listed some of them that are most important for the tick species in our region, again, for reference, or if you want to do some of this on your own. And so if you have a tick that hasn't fed, they're flat, they can actually be pretty easy to identify just based on gross morphological characteristics. And so the 3 main ticks of public health concern and animal concern here in Minnesota are the black-legged tick, the Lone Star tick, and the American dog tick. And so this is a nice diagram from CDC that shows some of those characteristics. So essentially, larvae are very, very tiny. You can see the picture of the larvae on the knuckle right here. This is one that you're going to have a really hard time finding on yourself or on an animal. A lot of times people call them seed ticks. And one of the distinguishing characteristics is their size, and they also only have 6 legs instead of 8 legs. The next stage is the nymph. And so at this stage, they have 8 legs. Their dorsal scutum, which you can see extends all the way back in the male, does not extend all the way back in the nymph. And so it's very small. This is a black-legged tick nymph on the fingernail. And so you can see that it may look like a freckle or just a speck of dirt, about the size of a poppy seed. And then the adult male and adult female are a little bit bigger, have the 8 legs. They're more about the size of a sesame seed, but it's still pretty small, especially if you're looking on an animal that has a large amount of hair on it. So in order to tell an adult female from a male black-legged tick, essentially the female is the one that has the reddish-orange back. A male's will have smaller mouth parts and just an entire black shield across their back. The Lone Star tick's a little bit bigger. It has more of a teardrop shape in appearance, and the females will have this little pretty iridescent spot on her back. The males are kind of nondescript. They're brown tick with these big mouth parts, and the males will kind of have what are known as a false set of eyes on the back, and so you can kind of see a unique pattern with them. With wood ticks that are shown at the bottom, American dog ticks, this is really by far the most common tick species that people come across in Minnesota. And so they're a big, meaty, brown tick, and they have this really pretty white ornamentation on them. And so to wow your friends and clients, to tell a female from a male wood tick. The female has what I call a necklace, and so she has this white scutum, and the male is wearing suspenders, and so you'll see some longitudinal stripes on the wood tick. But as a lot of vets see marble-like, large, engorged ticks that are really difficult to identify, it is helpful to put them under the microscope and look for various anatomical features in order to tell them apart. And so I've listed the 3 most common tick species here, but I do want to encourage you that if you have any questions or concerns, please have a low threshold to send us a picture, give me a call, send us a tick in the mail. We're really happy to help out with tick identification. And so for black-legged ticks, one of the key things that I look for when I put it under the scope is the anal groove. And these elements are not comprehensive at all, but they are some nice pointers in helping you distinguish the most common tick species that you'll come across in practice. And so you'll see that the anal groove is kind of this upside down U. This is the underside, the ventral side of the tick. The basis capituli is a fancy word for head. And so you can see that it has this unique shape. It's not rectangular like some of the other tick species that are in the following slides. The hypostome is rather large and pointed, and there are no festoons on the back side of the tick. And so when we flip forward to the American dog tick, you can see that it has festoons along the back. The anal groove is actually more of a Y shape, and the basis capituli is more rectangular in shape, and the palpi, which are part of the mouth parts, are rather short and kind of square shaped. And so this is in contrast to the Lone Star tick, which also has festoons and a Y-shaped anal groove, a rectangular basis capituli, but those mouth parts are really long and rectangular. So now I'm going to hand it off to Stacey to talk about some invasive tick species of concern.
All right, so the cattle fever tick is not a tick that we have currently found in Minnesota. There have not been any reports as of yet, but with our livestock populations as well as even small animal populations, people, products moving the way that they do, it definitely isn't out of the realm of possibility that these ticks could capture a ride up north at some point. We've actually had a lot of our federal counterparts responding as part of the cattle fever tick response down in Texas right now. So they've been seeing firsthand what is happening with that response. So I think it would be valid to keep this in the back of your minds as something to be thinking about and even potentially discussing with clients if the topic of ticks come up. The unfortunate thing about this tick, as you can see in the photo, is it's fairly nondescript. It looks like a brown tick. It doesn't have some of the ornamentation that Jenna had talked about in some of the previous ticks. It's fairly bland, so it may not strike you as something different. There, however, are known to be having quite excessive burdens on cattle, which is part of the problem with the response, is these ticks can have very overwhelming burdens. And this is actually something they share with the longhorn tick, which we'll be talking about next, in that the overwhelming infestations that these ticks can create on livestock, they also have the potential to vector bovine babesiosis. So in the event that you would be concerned that you might be looking at this tick, that would be a situation where we would want you to contact us, and we'll go over those contact information again as a reminder for the email and the mailing address for where to submit ticks or where to submit photos on these ticks so that we can keep our eye on this. With more ability to be able to do surveillance on these critters, we'll have a better ability to see whether or not something like this could be here and hopefully get a heads up and a faster response in the event something would be needed. And as a reminder, with some of the photos that we discussed earlier, this is again going to be a fairly nondescript, not inornate brown tick with no festoons. So as you can see around the backside, it doesn't have those that were shown on some of the previous photos. And in this situation, the basis capituli is actually shaped much different. It's not as rectangular. It's actually considered a hexagonal shape. And the palpi are much shorter. All right, now this longhorn tick, the Asian longhorn tick, which started spurring all of the conversations nationally. This tick was first found in November of 2017, or at least first identified to have been found in 2017 on a sheep in New Jersey. And since then, it has actually been identified in several other states. What is interesting about this tick is that with the announcement of it being found in New Jersey, many states have gone through previous tick identifications that they've done, and some of the identifications that have been found in these states were actually on ticks that had been originally identified as rabbit ticks, which is a tick that shares the genus with the longhorn tick, but under more recent scrutiny, they've been identified to actually be the longhorn tick. So here are the places as of September, so last fall, where these have been identified, and we expect the possibility with spring coming and ticks coming back into people's thoughts here, that we'll possibly be seeing more findings with these ticks this coming season. So some of the things to keep in mind about this tick: it is actually native to Eastern Asia, but it's become established in time in both Australia and New Zealand. One of the concerning things about this tick is it does not need a mate. It's able to reproduce asexually, and this can cause the overwhelming tick burdens that sometimes can be seen on animals. It's considered a biting nuisance and can irritate its host and cause a lot of morbidity as well as mortality. And it does have the potential to vector a lot of different tick-borne pathogens. The good news is, however, the ticks that have currently been found in the United States have been negative for the disease agents. However, the possibility is there, which is why it's important to begin surveillance around the country to ensure that if this tick is there, that we can identify any ticks and pathogens that may be found before they cause an issue in either people or animals. Again, there is a potential for this animal to be another invasive tick, so we're encouraging you as well as your clients to keep their eyes open about the possibilities of this tick coming in on livestock or even small animals if there's travel involved. And there is a potential, again, for this animal to introduce different diseases as well as spread endemic diseases. So some of those diseases you can see are mentioned here. And ideally, we would like to be able to find this tick if it's here so that we can do more education and help your clients be able to be more cautious in what we could see come from this invasive species if it were to be identified here. So at this point, we are working with a lot of different groups. So the Board of Animal Health, the Department of Health, as well as the Diagnostic Lab, the Indian Health Service, the Wildlife Rehabilitation Center. You can see multiple different agencies along with the USDA are working cooperatively to try to identify the best ways to get information out and the best ways to educate regarding the possibility that this tick provides as far as a threat for both our people and our animals here in Minnesota. We're developing a lot of content online as well as printed materials, and I know that Nicole sent out some information or at least made a link available to both the tick submission form as well as some other printed materials in PDF form that you can see that we have developed at this point that would be resources for both you as well as your clients. And we're also doing targeted messaging for other groups that are at high risk for encountering ticks. So how do you control a tick such as the ones that we are discussing? The most obvious thing is education, making people aware of the ticks and aware of what to watch for, as well as being able to actively look and do surveillance for the ticks to make sure that if they are in the areas that we can find them. We're interviewing and investigating sources to identify any additional detections in those areas in the event something would be found. And of course, tick control on animals and within herds through the use of appropriate preventatives or topicals, which we'll get to some of those for each animal species a little bit further on. We also want to minimize the spread of ticks throughout the environment. Widespread tick control can be difficult. Pesticide sprays and tick tubes are not always feasible in most situations, and pasture management, though it can be considered, can be rather difficult, as a lot of pastures aren't, it's not always feasible to be able to control grass and reduce access to forest if there's a lot of forested areas within livestock pasture. So some of the things to be on the lookout for with the longhorn tick, Jenna referred earlier to the keys for identifying these ticks, and these are some of the images that you can find in one of the keys in particular. You can see that they're very detailed images for anyone who actually has a strong interest in looking further into the anatomy of these ticks. So the longhorn tick is actually fairly similar to the cattle fever tick in that it's non-ornate. It looks like a fairly unexciting brown tick. But some of the things that you'll see, there are festoons that you can see along the bottom of the tick. And what is most interesting that gives this animal, this tick its name, is actually the horns on the palpal segments. So these areas right here is what gives the longhorn tick its name. So this is something that's different, for example, from its genus that has been the rabbit tick, which shares this genus, it doesn't have these long horns. So that's something that takes someone with some experience to be able to look under the microscope to identify the differences between those two ticks and why they were inadvertently mistakenly identified early on as a rabbit tick in some of those states. And now that we're aware of the longhorn tick's presence, there's, again, more review and more scrutiny on the ticks as they're being reviewed to ensure that we are finding and identifying longhorn ticks when they are found. So here's another photo again, and as well as a reminder is where these ticks have been found to date. Again, there has not been any sightings at this point, no reports at all in Minnesota, which is why this education is so important. If we're not looking for something, it sure is a lot harder to find it. So the effort is to get the education out that we do want to be looking for this tick and encourage you to talk to your clients about this. If a client would talk to you about seeing something unusual in their livestock or their animals with an overwhelming tick burden, this would be an opportunity to talk with the client about potentially trying to get a hold of some of those ticks and actually submitting them to see if they are one of these ticks of concern. And there, again, as mentioned earlier, there's a lot of different vector potential for these ticks, though none of the ticks, again, in the United States have been found to have these vectors. There is the potential, which is where the public and animal health concerns come in the event that these ticks become established and become established vectors for an array of diseases. This is a reminder, and again, you do have a PDF of these PowerPoint slides, which will allow you to refer back to any of these links or email addresses. So the health.bugbites address is a place where you can send some photos for identification in the event that you do find something or that a client brings you a tick and you would like to be able to transfer that image electronically to someone and have it reviewed to see what kind of tick that is. You could also submit the ticks directly through the address on the form, and as Jenna mentioned, there are prepared tick submission forms that you can get as well. which are prepaid envelopes with the tick submission form and everything all ready to go. So if you have a need for those, or if you feel that you have clients who may be interested in supporting this surveillance effort, it would be tremendous benefit to get some of those kits out to them or to your clinic for us to be able to do better surveillance for this. And then we'll talk about some additional tick resources. So these are some of the information that we had forwarded through the link that Nicole made available to you. And this is a new brochure that is launched, and you can see as recently as this month, which details some more information on the Longhorned tick and goes through various questions and answers. So in the event that you do have clients who bring this up, if somebody's heard about it in the news, this will give you something easily to be able to refer them to. We'll have all of this information as well accessible on our website. And this is a booklet, which will be available soon. There's a green block down here, which is a placeholder actually. We're still waiting for one more photo of the cattle fever tick to be able to finish off this. And then this will be available as a PDF as well as in print form for those that are interested. And then the Department of Health has some resources as well, which I'll let Jenna talk about a little bit further.
Yeah, so thank you, Stacey. So we have a lot of information on our website that you can go to health.state.mn.us/ticks. And through there, we have a monitoring webpage that you can find our black-legged tick distribution map that's just below this tick dragging picture here, and our tick identification submission form. If you press on this link, you'll pull up a PDF that you can print out or save and email to us. And so if you are interested in having a specimen submission kit for your clinic or your personal use, if you're out and about and encountering ticks a lot, I'd be more than happy to mail this postage page envelope out to you. It does have a copy of our tick identification card and brochure, as well as a vial and the tick submission form. We also have some printed materials in case your clinic would find them valuable. And so we have a handy dandy tick And we also on our website, just wanted to throw this out there, that we have disease-specific fact sheets for Lyme disease, anaplasmosis, and all of our other tick and mosquito diseases available in Spanish, Somali, Karen, and Hmong. They are geared towards public health, humans, but there is a lot of general tick information advice available in there. So before you go, we can't resist but throw out some tick-borne disease prevention messages. And so in terms of human health, we do not have a Lyme disease vaccine. There was one on the market several years ago, back in 2000. It was pulled from the market due to some concerns about it being having some adverse effects. It turned out to be a very safe and effective vaccine, but the company wasn't making a lot of money on it. There is some research being done, and we hear about a Lyme disease vaccine possibly coming on the market in 2023, so keep your ears open for that. But in the meantime, really, there's no silver bullet for tick control and tick-borne disease prevention. So it really relies on personal protective measures. So number one, being aware of ticks, raising awareness, raising education, especially now, especially from May through July, when adult black-legged ticks are out and the nymphs are coming out. Number two, get into the habit of checking yourself for ticks at least once a day after visiting tick habitat and even after seeing clients. It's certainly possible for ticks to be crawling on an animal and dislodge and find any sort of host nearby. And so to do a good tick check, you're really going to want to undress completely, shower after being outdoors so you can remove all the dirt, and be thorough. Think of yourself as having that exam. And so I like to use a floor length mirror, start at my toes, work all the way up to my head. If you can tumble dry your clothes and gear in the dryer on high heat for at least 6 minutes, that has been shown to kill any black-legged ticks that are remaining on your clothes. If you decide to wash your clothes before drying them, it will take longer. Ticks can withstand a wash cycle because they can close off their spiracles and survive underwater for a couple hours typically. So it's really the act of drying the clothes that's going to kill them. So if you wash your clothes first, throw them in the dryer for at least 60 minutes to make sure you kill the ticks. Bottom line, remove ticks as soon as possible before they have a chance of spreading disease. Number 3, wear tick repellent. And so there's a lot of different options out there on the market. Try to ignore all the marketing claims. Instead, look at the back. Typically by the barcode, you'll see an EPA registration number. That is your assurance that that product has been tested and that it's safe and effective to prevent tick bites. We typically recommend DEET and permethrin because they're great products. DEET, anywhere from 20 to 30% is effective for ticks. You can use it on your skin or your clothing. Permethrin is a really great product that you pre-treat your clothing and gear, and it typically lasts for at least several weeks through several washings. But always be sure to follow the label instructions. Despite all those prevention measures, it's really easy for a little tick to slip through the cracks. And so watch for symptoms after being around tick habitat or really any time this time of year if you're around ticks. And so the symptoms for tick-borne disease can be very nondescript, typically fever, sore muscles or joints, fatigue, lethargy. You can have some swollen lymph nodes or maybe anemia. The rash itself, I've put examples of the Lyme disease type of rash. It can look like a classic bullseye rash, but it doesn't always need to look like that. Sometimes it can be just a red blotch, or it can be multiple red blotches, and they're not often painful or itchy.
And as far as the protection of your patients from tick-borne disease, you guys are first and foremost the experts in this as you're seeing these animals every day. So we encourage you to continue to examine the animals and especially those areas where we would be more likely to find ticks. So you can see the image to the right shows some of the areas as an example on small animals where ticks can sometimes hide. As well as we encourage you to speak with your clients and advise them to keep their animals, when feasible, out of some of the areas where ideal tick habitat exists to just prevent those animals from coming into contact with ticks, as well as recommending appropriate tick preventatives for dog and cat patients. Year-round prevention should be encouraged, and of course, as a reminder to never use permethrin on cats. And then consider a Lyme disease vaccine for dogs when it is appropriate. And for large animals, there are options as well, as you're aware. On the right-hand side, this is just an image of what is being done down in Texas right now for cattle fever tick. This is likely not something that's being done here in Minnesota at this point, but just as an example of a preventative that is being done for the really overwhelming tick burdens they're seeing with cattle fever tick. And another good idea is to encourage clients to keep their fencing in good repair, to at least try to dissuade some wildlife from entering livestock areas. So as we know, a lot of livestock will find its way in or over the fence. However, if the fences are in good repair, hopefully that will at least dissuade some of the interaction between livestock and wildlife that can carry more of those ticks, as well as watching for clinical signs in their animals. So when you're talking to clients about possibilities of what tick encounters can be when you're discussing tick preventative, it's good to make sure that they have an idea of some of the ramifications that can come when their animals are exposed to ticks and ticks that could be vectoring disease. So similarly to what was discussed with humans, you can see a lot of similar clinical signs in the animal patients: fever, lameness, whether it's recurrent lameness or shifting leg lameness, as well as swollen joints, fatigue, lack of appetite. So a lot of different clinical signs, again, that are pretty standard for tick-borne disease and can be seen along with the human exposures to the same disease agents. We would just encourage your clients to be watchful, and well as to make sure that they keep you in the loop for any questions so that they can be on appropriate preventatives and that they can get treatment for animals that are exposed to tick-borne disease in the event that that's needed. I also wanted to quickly remind you about our reportable disease list. So vector-borne diseases of public health significance are listed on the Board of Animal Health's reportable disease list, which can be found at this web address right here. Some of the examples that we've been given from the Department of Health is Rocky Mountain spotted fever as well as tularemia. And both of these diseases, when reported to our agency, are actually forwarded to the Department of Health for follow-up. Lyme disease is not considered a vector-borne disease of public health significance, so this one does not need to be reported through this. In general, what happens with these reportable diseases is the results are reported whenever there's a positive test from any Minnesota animal. And when those are done within our state lab here, those are easily reported. However, if you're sending submissions out to out-of-state labs or private diagnostic laboratories, that reporting mechanism isn't always in place. So if you do have a positive animal test result from a out-of-state or a private diagnostic laboratory, we would encourage you to keep the Board of Animal Health in the loop on that so we can forward that or handle that as appropriate with the Department of Health. And if you do get one of those reports, this is an email address you can use to submit that positive case report or test report so that you can send it to our generic email address at the animal health email listed on the screen. And here are some additional resources if you're looking for more resources for yourself or your clients that we wanted to make you aware of. And again, these are all through your slides that you've received as well. And we only have a few minutes left if anybody happens to have any questions.
For those of you who can hear me, please remember to type your question in the chat area.
You know, to be honest, I'm not sure that we are probably the best resource for diagnostics as we're just not involved in that side of it, unless you have some specific guidelines. But the Board of Animal Health isn't really involved in the diagnosis of these themselves. So we would encourage you to work with the diagnostic lab you use to try to determine what they would recommend for the best profiles to be using. So if you're using the Minnesota Diagnostic Lab, we'd encourage you to contact them to find out what they would recommend.
Right.
And I guess I don't know if everyone can see these questions. So the first question was, what was recommended for a full tick-borne infection workup in a dog? So that was what my response was. And there's a follow-up question about what tick preventatives we recommend. And at least from our perspective, we try to make no recommendations for products of any particular distributor, as we don't feel like that's our role. Generally, the state tries not to recommend products.
And most of the products should be effective against both, you know, American dog ticks and black-legged ticks. So as long as you're using products that have been, you know, studied and effective for those species, it should be effective for most of the most common tick species that are found here in Minnesota. I know some of the products have waning efficacy against Lone Star ticks or some of the other really rare tick species that could come into contact here. But for the most part, I think most of the products that are registered out there are pretty decent. And one other thing just to say about the previous question about tick panels in a dog. So really, I think making sure that you're covering Lyme disease and anaplasmosis, those are going to be the most common tick-borne diseases. Ehrlichiosis, there's a strain that's, you know, possible here in the upper Midwest. So wanting to test for that agent. And then for Rocky Mountain spotted fever, potentially tularemia, you know, would be certainly considerations for a full workup there. In terms of, there's a question about, do possums actually eat ticks, or is it a legend to make possums seem less awful? So that there have been some stories coming out about possums. Yes, sure, they do eat ticks. They eat a lot of different things. So it's kind of just one of those things. They're certainly important in the ecosystem. We wouldn't recommend people getting a bunch of possums to try to make a difference about their tick infestation on their property. But, you know, it just goes to show that ecosystem health is important overall. And so another question about if you remove a tick and leave mouth parts behind, this is no longer considered a risk for transmitting disease. So from our standpoint, there is theoretically, you know, basically, we just try to enforce, get that tick off you as soon as possible. Don't worry about, you know, trying to get the mouth parts out and everything. Pretty much if a tick was infected with a disease agent, at the time you remove it, most likely that the agent is going to be already in you. So there's been no scientific evidence that indicates you're at increased risk. Certainly it can be a little bit of irritating and may cause a little secondary infection in the skin, but your body should work its way out like a sliver. So we really have tried to promote people, don't worry too much about it, just get the tick off of you.
I don't think there's any other questions at this point in time. So for those of you who've never attended this before, shortly I will be sending you a link to an evaluation and a PDF copy of your CE certificate. You'll get that by the end of the day today. So thank you everyone for joining us, and thank you to Drs. Bjork and Schwabenlander for their time and updating us on ticks. Everybody have a fantastic day.
Thank you guys all for joining us. If you have any follow-up questions, you can see our information here on the screen as well. Have a great afternoon.
Thanks.